we shall also try to understand how to administer a drug via intravenous route. Now we will not be demonstrating the intravenous route via an IV cannula, which is the route by which most drugs are given intravenously. Instead, we will see how a drug is going to be administered directly without a cannula via the intravenous route, that is an IV bolus or an IV push. So for this, we need to again choose a syringe and a suitable needle, and we aspirate the required amount of drug from the vial. So if we need to introduce, let's say 2 ml of the drug intravenously, we aspirate 4 ml of air, introduce that into the vial. As you can see, even without pulling on the plunger is moving back. So that's the advantage of introducing air into the vial before aspirating the drug. Take care to remove any air bubbles if present by tapping and by pushing out any air present. Now, the next thing that we need to do is we need to identify the site. It's always better to identify a site which is nice and straight. You should avoid flexures like the cubital fossa. So this is an area where we can find a part of the vein which is running reasonably straight. So once we have identified it, we need to take certain measures to make sure that the vein is nicely engorged. Now, one way to do that is to tie a tourniquet, apply a tourniquet. So there are many different types of tourniquets. So this is a type where we need to identify the rough surface of the tourniquet, the velcro surface of the tourniquet. We slip the tourniquet under the arm such that the rough part of the tourniquet comes in contact with the tabletop. Once we've done that, we identify the soft part of the tourniquet and slip it through this opening here. And then we fasten it like that. So now that's tightly fastened. That's one way in which you can engorge the vein. You can also tell the patient to make a fist tightly. We can tap the area. That also promotes vasodilatation locally. So by applying the tourniquet, asking the patient to make a fist, and by tapping the vein at that area, we can help make the vein engorge. Next, we disinfect the area with a swab of cotton, applying the antiseptic and disinfecting in a circular motion from the center to periphery 3 times using 3 separate swabs of cotton. Having identified the area, the vein where we need to introduce the drug intravenously, we introduce the needle at an angle of around 30 degrees. Now, to know whether we are actually inside the vein or not, it is good to aspirate gently and see if blood is entering the barrel of the syringe. If blood is not entering, it probably means that we have punctured both the superior and inferior walls of the vein. In that case, what we should do is we should gently withdraw both the barrel, we should withdraw the barrel and aspirate simultaneously. And the moment blood is seen to enter the barrel of the syringe, it means we have entered the vein. Once we are inside the vein, we take the tourniquet off. We take the tourniquet off and introduce the dose of the drug. Apply gentle pressure with a piece of cotton and withdraw the needle. So this is how we would administer a drug intravenously without a cannula as an IV push or an IV bolus.